On returning from New Zealand in 2009, I suffered a swelling to my prosthetic knee. I thought this was linked to spending 24 hours at altitude. My feet sometimes swell if I sit for too long. So I visited my GP, who prescribed antibiotics, but they didn't make any difference. In fact, I felt worse. I thought I had the flu because I was sweating, had aches and pains, a temperature, and I felt really tired. The next time I visited my GP, I was feeling considerably unwell. He sent me straight to hospital. I was shocked when they whisked me to theatre as an emergency and removed my prosthetic knee. In its place, the surgeon put a cement block that was packed with slow-release antibiotic beads. I also received intravenous antibiotics through a line to my chest for the next 6 weeks. At the time, I was unaware that I was close to death with a very serious infection. I had the cement block in my leg for almost 6 months. The intravenous antibiotics saved my life. The antibiotic cement block in place of my artificial knee stopped the infection travelling any further into the bones of my leg, saving me a potential amputation. It was a long 6 months for me, but one I recovered from. I now have a second knee replacement. I'm mobile, not as mobile as before, but still mobile, and I have a good quality of life. For this, I thank the skill of my surgeon. My surgeon thanks the antibiotic treatments that I received, without which I would not have survived or enjoy the quality of life I have now. I now know the name of the bacteria that caused my infection. It was Staphylococcus aureus. I know that without effective antibiotics, this infection could have killed me. I don't really understand how antibiotics work, but I do know they saved my life. Since my operation, I also know how important it is to only ask for antibiotics when I really need them. I also know they're a precious resource that saved my life. I also know that I'm grateful they worked. My wife is grateful. My 4 daughters are grateful, as are my grandchildren. I urge you to learn about how to use antibiotics properly. You never know when you'll need them to save your life. Until you need them, you'll never really appreciate how vitally and extraordinarily important antibiotics really are to ordinary men like me and ordinary families such as mine.